So very good afternoon to all. I am Dr. Shantanu Gupta, Chief Eye Surgeon at Avlokan Eye Center. This is situated in Tagore Garden, New Delhi. On this auspicious World Sight Day, we shall be discussing a few common problems causing blindness and how to prevent blindness causing diseases. First, to emphasize the organ, which is the eye, is such a sensitive and an important sensory organ. It is actually the window to the world. And remember, 80% of our memories are determined by what we see. So that cannot be overemphasized. World Sight Day is an annual global event which draws our attention to the blindness and impairment. And it is also an opportunity to create awareness and the treatments of various eye problems. Globally, we have about 2.2 billion people who are blind. And amongst these, almost half have impairment which could have been prevented. So that is a huge number. This is a brief view of the eye as to how the eye is seeing and how the image which is captured by the eye is actually processed in the brain, and then we see the final image. This is the brief anatomy of the eye, wherein we have the anterior lens and the posterior retina. This is basically the anterior part which images the object onto the retina at the back. So some of the common eye problems in children and older people could be different. In older people, we have presbyopia, cataract, glaucoma, age-related macular degeneration, and diabetic retinopathy. So I shall be primarily talking about cataracts. This is also known as Safed Motia, and it happens to be the most common cause of treatable blindness. Cataract or Safed Motia is basically the clouding of the normally clear lens of the eye. The lens, which is transparent like a glass, gets actually opacified or becomes frosty. It's like seeing through a frosty or a fogged up window. So if you can see on the right, this is normal vision. This is what a patient with cataract would be seeing. It is all frosty and foggy. So as we were talking, the symptoms of cataract include blurred or cloudy vision or dim vision, or also it could have halos around lights. That could be the reason. That could be the reason why the patient presents to us. There will be problems at night, and there'll be light and a lot of glare problems. Also, the colors are not so vivid; they'll be faded in perception. And one more common symptom which the patient presents to us is with frequent change in the glasses number. Now, coming to the causes of this important cause of preventable blindness, it could be eye injury or surgery. It could be obesity, hypertension, high alcohol consumption, hormone replacement therapy in some individuals, high exposure to ultraviolet bright light, for example, from the sun. Also, poor nutritional choices and smoking can lead to an increased risk of cataracts. These are all causes which are obvious. Most common cause being the senile cataracts being age as a result of normal aging process. So now cataracts, when do we consider intervention? Intervention is required when there is blurred, clouded vision or dim vision, or you have halos around lights, and the patient having the symptoms which I discussed earlier, he is not able to carry on with his activities of daily living, or it is affecting his lifestyle in a particular way which is not acceptable. So that is a time when we need to intervene and go in for the operative procedures to get rid of this problem. Now, what happens during cataract surgery is, as I said, the lens gets clouded, so we have to remove the clouded lens and we replace it with an artificial lens, as you can see in this picture, very beautifully depicted. The artificial lens is also called the intraocular lens. It is positioned in the same place as your natural lens is placed, and it remains a permanent part of your eye for the rest of your life. In rare instances, however, some problems prohibit the use of an artificial lens, and in these situations, once the cataract is removed, the vision can be corrected with eyeglasses or contact lenses. Cataract surgery is done on an outpatient basis. I call in the patient at about in the afternoon. If I call the patient at about 3, so he's good to go by 5 o'clock, he's good to go back home. During cataract surgery, your eye doctor will use a local anesthetic to numb the area around your eye, but you will stay awake. You know, I keep talking to my patients during surgery and makes them comfortable and feel reassured. And it's a very safe procedure. And after the procedure, you'll have a slight discomfort. There'll be no pain for a few days, and that too will go away in a couple of days. And healing generally occurs within the next 6 to 8 weeks. That is full recovery. Glaucoma I discussed last time. An important also aspect I would like to highlight today is diabetic retinopathy, wherein the diabetes, which is such a major problem, it's like a pandemic today worldwide, and especially in India now. It affects the back of the eye, that is the retina, because it is caused by the damage to the blood vessels of the light sensitive tissue of the back of the eye or the retina. At first, the diabetic retinopathy may cause no symptoms. Eventually, it can cause ultimately blindness to happen, which is irreversible. So cataract, which was a reversible cause of blindness, diabetic retinopathy on the opposite side is an irreversible cause of blindness. And hence, the importance of screening and proper diagnosis, timely diagnosis and intervention becomes very, very important. So these are other disorders we had discussed in the past. Thank you so much. That will be all for today.